Hey everybody, my name is Mark Fox. I'm with CBG Health. I'm a healthcare consultant for self-funded health plans, and I think it's very valuable for you guys to understand that having the right key partners will make a big difference in the supply chain of your healthcare for self-funded employers. That's why I wanted to introduce you guys to Judi Braswell. She's working with Lakeview Health in Jacksonville. She's actually out of Alabama, but I want to introduce you to her and what they do and how kind of COVID is affecting your employees from a health or addiction perspective. So Judi, the COVID thing is going on. Everybody's really concerned about how that's affecting, the addiction rates going up and whatnot. So, how is COVID affecting, the addiction and mental health needs of employees across the country?
Yeah, we're seeing the stressors of COVID have a real impact in increasing consumption and exacerbating mental health symptoms, because obviously we have people that are in fear of the virus, they are in fear of losing their job, or perhaps they're working long hours. Childcare, child education issues we're seeing a real impact.
Well, it's, a lot of times when I've seen care issues, it's because of a barrier, some sort of barrier. And employers have these, they have high deductibles, co-pays, whatever, or are hard to access sometimes. Maybe they have a very micro network to try to reduce cost, and so it's an access issue. So what are the best ways for an employer to identify if they have a financial or an access barrier to these types of medical needs?
I encourage claims analysis to compare in-network versus out-of-network access for behavioral health issues, because we know that there are a lot of behavioral health providers, and that number seems to be raising daily, that don't participate in networks. It's also helpful if you have an EAP to talk to them, find out if there are areas where you have employees that they have difficulty with the provider network or scheduling appointments. And then if your behavioral health claims are less than 3%, it's likely that you have either an access or a financial barrier, and you perhaps are paying for behavioral health claims in other areas. They're seeing non-behavioral health providers and being treated for migraines, aches, pains, gastro issues, those types of disorders.
Yeah, it's kind of a balloon effect. Not getting that care early generates that bigger and bigger and bigger claim. So they need to hop on it quickly. So I appreciate you doing that. A lot of my employer clients, they save money by just changing the way that they purchase healthcare. So what are some strategies that an employer out there can do to help lower the cost of the way that they purchase mental health, addiction health, care services?
A center of excellence like Lakeview Health can be very effective in ensuring that all of your members have access to care by a highly qualified staff, evidence-based treatment, the support that they need after treatment to be successful. And of course, substance abuse treatment and programs across the country really vary, so that can get you some consistency there. We also offer employers an opportunity to contract with Lakeview, and it allows the financial barrier to be removed. Patients that complete the program recommended by our medical and clinical staff, after discharge, if they require readmission within 90 days, when a lot of the relapses happen, we bring them back at no additional charge. So that is protecting the employer from the cost associated with readmissions. And in a recent audit by a major payer, our readmission rate was 4%, which is significant in our industry.
Wow. So basically what I'm hearing you say then is it's kind of like risk reversal. You guys are taking the risk on the services that you provide, meaning that, hey, if someone's got to be readmitted in 90 days after going through the program, we cover that cost. Is that what I'm hearing?
Exactly.
Okay.
And oftentimes it's a very brief program with some relapse prevention strategies, and they are able to then be successful.
That's great, because that keeps that merry-go-round from keeping around and around in the same person over and over again. So I love that. I really appreciate it.
Exactly.
What other resources would you suggest for some of the employer groups out there?
Lakeview would welcome the opportunity to provide free webinars for employers, work with them on topics that are appropriate and helpful for their workforce, as well as communication materials. So I would love to connect with employers that would like to learn more.
Great. Thanks, Judi, for your time today and for sharing all that very valuable information. Really appreciate it.
Oh, thank you for having me.